There are 5 significant global diseases that continue to pose significant health challenges worldwide. 1. COVID-19. COVID-19, caused by the novel coronavirus SARS-CoV-2, emerged in late 2019 and quickly became a global pandemic. It has had a profound impact on public health, economies, and societies worldwide. Symptoms range from mild respiratory illness to severe pneumonia. And the virus can be transmitted through respiratory droplets. Vaccination efforts and public health measures are being employed to control the spread of the disease. 2. Malaria. Malaria is a mosquito-borne infectious disease caused by parasites of the Plasmodium genus. It remains a significant health concern in many tropical and subtropical regions. Symptoms typically include fever, fatigue, headache, and chills. If left untreated, malaria can be life-threatening. Prevention measures, such as mosquito control and the use of bed nets and antimalarial drugs, are crucial for combating the disease. 3. HIV/AIDS. Human immunodeficiency virus, HIV, weakens the immune system and can lead to acquired immunodeficiency syndrome, AIDS. Although significant progress has been made in HIV prevention and treatment, the disease remains a global health challenge. HIV is primarily transmitted through unprotected sexual intercourse, contaminated needles, or from mother to child during childbirth or breastfeeding. Antiretroviral therapy, ART, can help control the virus and prevent the progression to AIDS. 4. Tuberculosis (TB). Tuberculosis is an infectious disease caused by bacteria belonging to the Mycobacterium tuberculosis complex. It primarily affects the lungs but can also affect other parts of the body. TB is transmitted through the air, when an infected person coughs or sneezes. Symptoms include coughing, weight loss, fever, and fatigue. Timely diagnosis, proper treatment, and adherence to medication regimens are critical in controlling the spread of TB. 5. Influenza. Influenza, commonly known as the flu, is a highly contagious respiratory illness caused by influenza viruses. It can lead to mild to severe illness and, in some cases, even death. Influenza viruses can undergo seasonal changes and cause annual outbreaks. Vaccination is recommended to reduce the risk of infection and severe complications. Antiviral medications can also be prescribed to treat or prevent the flu.